Hello, my name is Alfredo Mena-Lora. I'm an infectious disease specialist here in Chicago, and I'm talking to you on behalf of MedGlobal. I wanted to talk today about vaccines. The coronavirus vaccines are on their way to the general population, and in general, it's important for us to understand what these vaccines are about and that we answer any question or any doubt that we may have about them. So in these brief slides, I wanted to go through key concepts and some frequently asked questions. But first, I wanted to explain a little bit about what the vaccine does, how it works, and then answer some frequently asked questions. So this is a kind of the basics of how your defenses work. This is the virus, and this is the antibody. Your antibody is your body's defenses. It basically binds to this part of the virus, rendering it useless and also prompting your other immune system, your other immune cells to fight it. With these vaccines, and currently we have Moderna and Pfizer as vaccine options. Both of these vaccines are what's called an mRNA vaccine. They do not have the virus. What they have is a little code that goes into your body, and with that code they can produce this protein, which is basically this part of the virus. So you're just showing a part of the virus without the virus itself. This part is innocuous, it doesn't cause anything, but what it does do is generate antibodies against that part. So eventually, once you have all these antibodies and your defenses are primed, if you get exposed to the virus in the community, you will be protected. And how do we know that this works? Well, the main thing is to recognize that we have multiple phases of studies. Phase 1 and 2 are mainly focused on safety. We want to make sure that these vaccines are safe, and then on phase 3, we want to make sure that they work, that they are effective. So, safe and effective vaccines, safe and effective medications, everything we do in medicine, from your regular blood pressure medication to a vaccine, everything goes through these phases, proving that they're safe and eventually proving that they're effective. So how did we prove that this vaccine is effective? Well, over 40,000 people were enrolled in this massive study that basically enrolled people and randomly assigned people to either placebo, which is basically just water, or vaccine. And then they went about their lives. And as you can see here, as expected, because there's a lot of coronavirus in the community, people started getting coronavirus as they would have done otherwise. And then after 6 weeks, because this study is blinded, we don't know who got what, in order to try to reduce bias and make the study more strong. After 16 weeks, they took a look at the information and they realized that it was not just effective, but very effective. The people who received the vaccine, unlike those who didn't, were protected over 95%. Some of the folks who got coronavirus in the vaccine group got so early, within the first week or two, before their immune system was primed, and arguably some of those already had the virus prior to getting the shot. Eventually, people still got it here and there. No vaccine is perfect, but 95% good, 95% effective is very, very, very good and near perfect. Even better, the 5%, those who did get COVID after getting the vaccine, none of them required hospitalization. So the fact that you had the antibodies either protected you completely from getting disease or minimized your disease drastically. So this is exactly why it's so important to get this vaccine. I personally would like to be in this group, and therefore I got vaccinated. So a couple of frequently asked questions. The first question that I get asked is, what do you expect when you get vaccinated? And like any vaccine, you might feel some chills, you might feel a fever, you might feel some body aches. That's just your immune system recognizing that protein and developing the defenses, developing the antibodies. So it's not like you're getting coronavirus, you're just reacting to that little protein that doesn't cause disease. your immune system, whenever it reacts, as with any vaccine, it will cause, a reaction. But that reaction is mild. I felt fine. I took some ibuprofen and I was out and about. Are the vaccines safe? The answer is yes. As I mentioned, in the studies alone, over 50,000 people received the vaccine without any safety hazards. Now, or I should say by now, we are looking at hundreds of thousands of people in the United States, probably over 1 million worldwide, receiving this vaccine. Millions of people have received it all over the world and are doing great. Is it safe to get the vaccine while pregnant or breastfeeding? So the answer is yes. This wasn't included drastically in the studies. It's harder to include pregnant folks in clinical studies, just numerically speaking. However, the American College of Obstetrics and Gynecology, which is the group of specialists that particularly know everything that has to do with pregnancy and breastfeeding, they say yes, go for it. Is it safe to get a vaccine if I have an underlying medical condition? The answer is a resounding yes. In fact, having an underlying medical condition puts you more at risk of COVID-19 related complications. So you're kind of more priority, and getting the vaccine will reap much more benefits for you. So it's yes, underlying medical conditions were included in the studies, and those are the folks that will get more benefit, or I should say are at higher risk of developing disease and therefore would benefit more from the vaccine. Is there a risk of severe allergic reaction? There is, but it is a minimal risk. It is extremely rare. And the truth of the matter is you can have an allergic reaction to any medication, to any vaccine, and to any food for that matter. You may not realize that you are allergic to, say, shrimp, and then all of a sudden you are. These things can happen. However, it is extremely rare. Whenever you go get vaccinated, you will be monitored for 15 or 30 minutes, depending on your history of allergies. And the clinic or the place where you will get vaccinated will have all of the equipment to handle any potential allergic reaction. Now, what should you do? You should talk to your doctor, who knows you best. You should, number two, take a look at the FDA or the CDC website, where you can take a look at all of the components of the vaccine to make sure you're not allergic to any one of those. Other than that, talk to your doctor and you should be okay. When is my second dose and can I miss it? Well, the Pfizer vaccine, the second dose is at 21 days, and the Moderna vaccine, it is at 4 weeks or 28 days. So in general, that's what was studied, and that's what should happen. So you should not miss it. You're going to get a better, robust immune response with your second dose, and it's what was studied, that 95% is from 2 doses at 21 days, not 28, not 40, 21 for Pfizer. So you should always follow what the protocol says. Now, experts believe that 2 to 3 days difference there may not matter too much. And if for whatever reason you can't take it at 21 days, a compelling, drastic reason why you can't take it, then it's still better to get your second dose at some point. But that is not what's recommended. What's recommended is what was studied, which is what I've explained here. Can I get 2 different vaccine types? The answer is no. The CDC, however, does recognize that in a hypothetical situation where you got your first dose and no other doses available, some drastic situation like that, then maybe. But is it recommended? No. You should follow what was studied. What was studied was a shot of Pfizer and then 21 days later a second shot, or a shot of Moderna and then 28 days a shot of Moderna. What if I had COVID-19? This is a great question. In general, 90 days after COVID, you're probably somewhat protected before 90 days. So for about 3 months, you may have what's called natural immunity. Now, is natural immunity perfect? No. In fact, we have people getting COVID twice. And sometimes that is even more severe COVID. So there's too much we don't understand about natural immunity, and therefore vaccine immunity is what's preferred. The CDC recommends that you get the vaccine regardless of whether you had COVID before. They recommend that you defer it if you're currently being isolated for COVID. So if you are actively having, symptoms of COVID, if you currently have COVID, then you should probably not get the vaccine. But once you're done with your isolation period, then talk to your doctor, and if a vaccine is available, the CDC recommends that you go ahead. Understanding that there is a 90-day period that you might have protection anyways, I personally would get it as soon as I'm no longer ill with it, which is what the CDC recommends. A couple of other final questions. How long does the vaccine work for? This is something we're not sure, but we believe that around 12 months. Experts are looking at this. Experts estimate 12 months, but we're not 100% sure. We're not 100% sure because sometimes your immune system kind of goes down with regards to its ability to respond for something. Another thing is that the virus itself, the spike protein that you are primed for, that can mutate and change, meaning that you might need to develop new antibodies with a new vaccine. So this current vaccine for the spike protein that we know should last about 12 months. But if there's a new version of this that requires a different vaccine, then that's another reason why your vaccine protection may be limited somewhat. In fact, that goes into these last 2 or 3 questions. You cannot resume normal activities once vaccinated. First of all, the vaccine itself can take 1 to 4 to 6 weeks or so to fully be take your immune system where it should be. But regardless of that, you don't know if at some point you might be exposed to a mutated virus. Another important point is we know that the vaccine protects you from developing symptoms, but is there a possibility that you can get exposed to coronavirus, not have symptoms, and still transmit it with your, that's a possibility for vaccinated folks. So you need to still wear a mask to protect unvaccinated people. You need to still do, quarantines and all of the social distancing measures, including making sure you be careful and try not to travel. Why? Because you want to reduce the likelihood of exposing yourself to a mutated virus that perhaps has evaded some of the vaccine features that your immune system has. These are complicated things, but in short, the vaccine will protect you. It will likely protect you even if the virus mutates, but we are learning more about this, and we have to remain protected, not just through the vaccine, but through our activities as well. This will protect you, but it will also protect your family members, co-workers, and so forth. One final question is related to whether you get COVID after your first dose of the vaccine. So if you get COVID after your first dose of the vaccine before your second dose, there's not a lot of clear guidance on what to do. The CDC mentions the same 90 days that you could potentially be protected, but most experts, and the CDC as well, mentions that getting your vaccine right after you're done with the acute illness of 10 to 20 days, once you're done with isolation, to go ahead and get your second shot. This is not 100% something that we know for sure what is best, but most experts recommend just getting the second dose as soon as you're doing okay and no longer actively infected with COVID-19. And with that, I hope I answered most of your questions. Thank you so much. And remember to seek information. Go to the CDC website or the Infectious Disease Society of America. A lot of information there about vaccines, and always talk to your doctor. Thank you.